and good afternoon, everyone. I'm Aaron Levo, the Vice President of Communications, Public Affairs, and on an interim basis for Human Resources. Welcome to today's HHS Town Hall on December the 15th. We've got a good agenda, but perhaps a shorter agenda today. We'll see how it goes. The usual things that you'd expect to hear, and maybe we'll have a bit more time for celebrations. As normally, we will have the Q&A function open, and you can answer questions at the bottom of your screen using the Q&A function, and our panelists will answer live. As those questions are answered, the answers to them kind of stack up in the Answered tab, so you can review answers to the questions in the Answered tab as we go, and you can ask questions at any time. And if you come up with a question and maybe after the fact you want to ask it, you can always email that question to the HHS News inbox, and we'll have that address up later for you. And of course, as I've already mentioned, this entire town hall will be recorded and made available online and on the hub. We'll have celebrations at the end, so keep that in mind as we go, things that you'd like to shout out, people, programs, accomplishments, and we'll leave the chat function for our celebrations at the end. So I think that's all the housekeeping from me, so I'll turn things over to our President and CEO, Rob McIsaac. Rob, over to you.
Thanks very much, Aaron, and good morning, everybody. Thanks, as always, for joining. As we begin, I want to acknowledge that we are privileged to provide care on lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. We're winding towards the end of the calendar year, I'm going to speak relatively briefly, but wanted to begin by thanking staff and physicians for an extraordinary year over the past year. We've seen extraordinarily pressured system across all of our sites, but notwithstanding that, we were able to achieve some very major milestones, not the least of which was the go live of Epic. So I'm so proud of the whole team and very grateful to everybody for all that they've done over the course of the past year. Maybe just to mention that I think over the last little while, none of our sites has been more pressured than the Children's Hospital. And I think, a number of units at McMaster Children's continue to be under very high stress levels. We are hopeful that we've seen the worst of it, and that there may be some downward trends that are developing. So that's something that we can all keep our fingers crossed around. But in the interim, we've definitely put in place a number of extraordinary measures to try to help the teams out at McMaster Children's. They range from caring for some of our older pediatric patients at acute sites. We've opened a flu, COVID, and cold clinic to try to alleviate ED pressures. We've added some space to provide care for the many young patients who we are seeing with suffering from respiratory illnesses. In a few moments, we're going to talk about some of the concrete steps that are now in motion to ease some of those pressures across all of our sites and to overcome some of the health human resource challenges. So just wanted to make sure that people understood that we are doing all that we can to try to address this very challenging situation that we continue to be in. I'm going to turn it over to Sharon for the time being. We'll pop back at the end of today's town hall. But Sharon, over to you for an operational update.
Great, thanks, Rob, and good morning, everyone. Happy to be here today to provide the update. In terms of our COVID numbers, you can see we are down. There's only 52 patients across our sites, less than 5 in ICU and less than 100 staff in self-isolation. So that's good news, and I hope that trajectory continues. If we go to the next slide, in terms of the occupancy status across our sites, you can see in an aggregate, we're just hovering at 100% across all of our sites, and you can see the distribution across our acute sites. So the pressures remain As Rob indicated, very significant across the sites, particularly at McMaster. You can see the two numbers there, the overall site occupancy that includes pediatrics and women's health at 87%, but just within the pediatric hospital at 116%. So an inordinate stress being faced at our children's hospital. And then also you'll note our ALC, again, just sitting close to 250, which is very high for our organization. The next slide, please. Just wanted to insert today just a few run charts looking at our EDs and what's happening with our volume. So you can see the McMaster in the top left. You can see that significant peak that we have been experiencing with visits well over 200. And we have been on a bit of a downward decline, a little bit of fluctuation day to day with that, but the trajectory is going in the right direction. It does not, though, at all address the inpatient and PICU pressures that continue to be quite pronounced. And then you can see there's a bit more stability across our other acute sites with the Hamilton General in the top right, the Juravinski, and then a little bit more variability at the West Lincoln site. As an aggregate across all of our sites, we have well over 50 patients waiting for beds today, sitting in our emergency departments. The next slide, please. In terms of, overall general assessment, certainly these widespread pressures are being felt at HHS, but across all of our partner sites, as I'm sure people are well aware from the media. And again, most pronounced in our emergency and our critical care areas, but does not negate that the other inpatient areas are not also very stressed, as are our ambulatory with the backlogs that are being faced. Our surgical capacity is sitting at 88%. That's being driven a bit by some more same-day surgery and less same-day admit surgery, but nonetheless, it's sitting at 88%. We are seeing some changes in our trends with respect to length of stay. So we are seeing in some areas that length of stay increasing because of challenges with discharge dispositions and access to supports in our community, which is not a new issue, but perhaps a bit more pronounced. And in terms of how we're managing this on a daily basis, it's probably much more closer to the 60 and closer to the 70 unfunded beds that we have open to try to address the pressures. And I've already spoke to the ALC. And the next slide, please. In terms of pediatrics, Rob highlighted some of the activity in order to mitigate the pressures at that site. Certainly not a strategy we want to have, but we have had to limit the surgical activity to free up the inpatient beds for the unscheduled care. There continues to be a deferral of the Waterloo-Wellington region patients to London Health Sciences. There is the provincial order still in place around the care of 14 patients older in adult beds, and that's across Ontario. And then we have our own models in place for the youth in medicine and surgery beds that are 16 years and older. As I mentioned last week, we continue to offer the option to those patients that are appropriate at McMaster Children's to utilize the urgent care center. And this week we did open the new flu, COVID and cold clinic within the McMaster site proper. So we're hoping that will pull a little bit of the volume away from the ED. There is some renovations underway that are almost complete to allow some more physical space for critical care level patients. So that is being prepared and we'll use it as necessary. And we have continued to ask for volunteers from across all of our sites to volunteer to pick up shifts within the McMaster site, along with inviting our non-union and nursing trained staff and leaders to pick up extra shifts as they're able to do as well. And we will be moving to a reassignment of some staff to support as we must do at this point to ensure safety within the McMaster Children's Hospital. And the next slide, please. From an overall operations update and where we're at, we continue to advance our planning with our partners in the community. There continues to be a focus on our admit avoid strategies and our post-acute strategies, working with partners, particularly for those ALC designated patients. We continue to see success from the new repatriation policy, which really That requires a 48-hour transfer. That's for our adult acute population. We have looked at all of our physical space across our sites to maximize as we are able. We are going to hear about our HR planning today, of which there has been substantive amount of work to advance our strategies. We have sustained our callback model within specific roles to ensure we have a workforce to support staff. And I mentioned our reassignment process. So there is a lot of work underway. I'm sure it doesn't feel like that every day for those working on the front line, and I apologize for that. But with Rob, I do share immense gratitude because I know it has been an untenable pressure of late and over the course of the last few years. So I extend my thanks for that and happy to accept questions in the Q&A. And back to Aaron.
Yeah, thanks very much, Sharon, for the update today. Just a reminder to folks, as Sharon pointed out, you can post questions in the Q&A function and we'll answer them as we go. So next up, my colleague Leslie Gillies is going to join us for an update around our workforce planning, which is a strategic initiative in our corporate strategic plan. So Leslie, I'll turn it to you, and I think I'm going to help out a little later, but you'll start.
Okay, thank you, Aaron. Good morning, everyone, and thank you very much for joining today. Aaron and I will be providing you with an update regarding an important transformation initiative, workforce planning. Aaron and I are both co-chairs of the steering committee leading this work, and we're very appreciative of the members supporting and all those that are providing input and direction as we move forward. So at the last town hall on December 1st, we shared information about our updated strategic plan. And as we know, the strategic plan does act as a North Star for us, guiding towards a common vision. At HHS, our strategy is built on 4 pillars: patients, people, sustainability, research, innovation, and learning. Of course, supporting the pillars are our 3 strategic directions: population health, strategic partnerships, and operational excellence, all of which moves us towards the vision towards best care. Transformation initiatives, corporate projects, and in-year objectives are the components of work that will have the greatest positive impact upon the frontline care we provide. This year, we are focusing on 4 transformation initiatives: our Healthy Future, Epic Optimization, Post-COVID Recovery, and of course, Workforce Planning. So workforce planning, we're going to provide a bit more detail for you today and also provide any opportunity for questions and input as well. Next slide, please. Like all hospitals, we know that HHS is experiencing significant staffing and capacity pressures. The impact of these challenges spans a variety of clinical, non-clinical, and medical roles and services. And although these challenges do predate COVID-19, unfortunately, the pandemic has accelerated them. Other factors contributing to health human resource challenges are a global shortage of skilled staff, evolving demographics in the workforce, predicted year-over-year increases in retirements, and challenges that we're experiencing in retaining people. We know that health human resources will continue to be the most significant challenge for our sector for the next decade. HHS senior leaders recognize how difficult and stressful it is right now for frontline leaders, staff, and physicians, and we have made workforce planning the key priority of our updated strategic plan. Next slide. Workforce planning means finding immediate, intermediate, and long-term concrete solutions that will provide our hospital with a stable workforce so that we can continue to provide safe, high-quality care to our patients. To inform our decisions, the Workforce Planning Steering Committee is gathering input from within Hamilton Health Science and is looking at best practices from other organizations. Our short-term focus is on identifying and prioritizing efforts that stabilize the most critical staffing gaps, impacting clinical service continuity, and optimizing models of care. Our intermediate and long-term focus will be on developing and implementing process changes and innovative strategies to help us succeed in a highly competitive labor market. Workforce planning is one of our greatest challenges. This is an opportunity for us to think boldly and collaboratively at the work, as the work we do here needs to be innovative in order to solve the problems that we are currently experiencing. Next slide. The Workforce Planning Steering Committee is working together to understand our current state challenges, pressures, and opportunities, and develop a prioritized roadmap for action. Here at a high level, you can see the timeline for that work. As I mentioned, our immediate priority is stabilizing the most pressing and urgent gaps. In the intermediate term, we're looking at ways to sustain those stabilization efforts and develop and implement supportive and innovative models of care to address and support our staff and our patients. Long term, we need to proactively address our workforce and labor gaps to ensure stability in our workforce for the future. I'm going to now turn things over to Erin to talk about what's already happening at HHS to realize these goals. Thanks, Erin.
Yeah, thanks very much, Leslie. So I think building on what Leslie's saying, like the emphasis for sure going forward is going to be on increasing stability and as well taking some bold steps in the medium term. But it's not to say that we haven't been applying effort already. There are some things that are happening across the organization today. And, you know, we absolutely need to do more. And I think the steering committee has been having some very good, frank discussions about that and looking across the organization at opportunity and also looking to other healthcare centers across North America and seeing what they're doing. But some of the things that we are doing that we're proud of is for sure creating standby clinical teams in high needs areas, expanding our clinical extern program and internationally educated nurse programs, looking at the healthcare aid and essential caregivers programs, making sure that our learner placements are maximized across the organization, centralized recruitment, which is now getting close to almost 70% of our nursing recruitment. We're expanding that across the organization, noting that it does remove some of the administrative burden from our leaders who are always recruiting. We just find ourselves in that position now in a very competitive market. And as well, we're looking at ways to strengthen our staff retention. And that for sure has to do with the wellness initiatives we have in place and the recognition efforts, Star Week, which we are in, but it also has to do with the kind of culture we have as an organization and how we're supporting the best possible place to work. So a lot of thinking is going into that, and you're going to continue to hear more about it. Certainly always open to feedback. You can provide that. Everyone knows how to get a hold of me or Leslie. You can also use the HHS News inbox, but as we progress, really looking to hear from people about what you think. And there'll also be some surveys to that effect, in addition, leveraging the recent My Voice Matters survey, which we know we're going to be rolling the results out to very, very soon. So I'll leave it at that. We just wanted to make sure that we made it a point to make it a part of the agenda today to let people know that this work is happening and what it's all about. It's going to be a really big emphasis for the year ahead. Okay, so I think that's the final slide in that section. We can probably move ahead. If you haven't already asked that question that you wanted to ask, you can do it anytime. And if we don't get to you before the close, we'll make sure you get an answer. I'm going to suggest we move to our celebrations, though, which is always a highlight for me in terms of whenever we have these town halls. I'd welcome anybody to put your hand up and you can give your shout out live, or you can type it into the chat function and we'll read it out. So Q&A for questions, chat function for celebrations. Leslie Gillies, you're quick off the mark. What's your celebration today?
Thanks, Erin. I'd like to extend thanks to the staff-led team of the Gentle Persuasive Approaches coaches, or the GPA coaches, whose twice monthly workshops continue to receive rave reviews over 2022 from staff everywhere in the organization. These educational sessions provide strategies for teams in supporting our patients with dementia. So thank you. Sincere appreciation to everyone that contributes their time and their wonderful insights and experiences to share with their colleagues.
That's awesome. Thanks very much. Let's see here. Just see a question here, Pat Swidowski. Pat, I'll just answer your question. And if you have another one or a follow-up, just type it into the Q&A function. But as I see it here, yeah, for sure, there's a timeline for rolling out the results. We just actually agreed upon that this week. We're getting ready right now and doing some internal synthesis. You can look to have that in the first couple of weeks of January start to roll out to teams. We've got to sequence it across our leaders first to make sure that they have all the information and can answer questions for their teams, but we're in the process. So you should have that at the beginning of 2023, and we'll that's the timeline. Okay. What else? Here from Susan Pucciarelli, congratulations to Monica Speckens on becoming our new manager of employee health services. Welcome to the team. Well, Monica's already on the team, but congratulations, Monica. I see Rob with his hand up. Rob, what would you like to celebrate today?
Yeah, thanks, Aaron. I wanted to give a shout out to Dr. Packer and to Bruce Squires and to the entire team that worked so hard to get the clinic at McMaster Children's Hospital up and running, aimed at diverting some of the young people in the ED with respiratory concerns out of the ED and into that clinic. It was kind of a monumental effort to get it up and running so quickly. So amazing work to both of Bruce and Tammy and the whole team.
Awesome. Thanks, Rob. Dave, I see you have a hand up. What would you like to celebrate today?
Yeah, thanks, Aaron. Probably two things. The first was going to be just a shout out to the Odyssey team. The Odyssey Steering Committee had its last meeting this week, and one of the things we were able to report out on was the stabilization efforts on the 13 large, more integrated issues. Most of those have all been closed off and signed off and complete, and we still have some in some areas around some external reporting, but it was a tremendous accomplishment to cross that finish line while supporting things like standing up some of the new space at McMaster. So just a huge shout out to the team there. And then the second thing would be just a specific and special thanks for all of the leadership efforts and impact that Carissa Corden had on the Odyssey project. I've gotten to know Carissa through that project more than I would have before, and that was my privilege. And we're sad to see her leave HHS, but wish her all the best in her and the next steps in her career.
Fantastic. Thanks very much for that. I see something here from Kelly Lynn Nance Cavell. Kudos to the Education Department for the return of the annual review at JH230 at the JH230 attendees. All right, thank you for that, Kelly Lynn. I see Sharon Pearson with a hand up. Sharon, what would you like to celebrate?
Yeah, thanks, Aaron. I just wanted to extend a thanks to Kelly O'Halloran and the Hospital to Home team. Every year, they put an inordinate amount of work into gathering gifts to help those in our community who aren't able to have family with them or don't have family for the holiday season. So thanks to Kelly and her team, because it is a massive amount of work and coordination to do this. And thanks to everybody who has contributed. It is unbelievable the amount that has come forward to help these patients and families that we continue our partnership with into the community. So thanks to everyone for making the holiday season a bit brighter for some people. Thank you.
Yeah, very remarkable and moving program. For those that know about it, you know that, and for those that don't, look into it. It's a great way to give to the community for sure. Okay, well, I don't see any additional hands. Nothing further in the chat. So I'm going to suggest we leave it there for today. Rob, to you for final remarks, and we'll see everyone next time.
Thank you, Aaron, and thanks everybody again for joining today. As I said off the top, I think it's been an extraordinary year where our staff has risen to meet these unprecedented challenges while also achieving some huge milestones. So thank you very much, everybody, for all that you've done for our community and our hospital and our patients. Together, we've dealt with this global pandemic and its aftermath for nearly 3 years, and I know all of this takes a toll. So I hope many of you are able to find some time over the holidays to rest and regenerate. For those of you who will be working over the holidays, thank you so much for continuing to rise to the needs of our patients and our community. And I also will just finish by extending season's greetings to everybody and their families. Happy holidays and very best wishes for peace, health, happiness, and prosperity in the new year. Thanks all.